Breast cancer-related lymphedema is very common among patients. In fact, it can affect up to 20% of patients following their treatment. My name is Barfin. I'm a doctor of physical therapy and I specialize in lymphedema and cancer rehab. In this video, I will show you step by step how to apply compression bandaging for lymphedema in upper extremity. Compression is a component of complete decongestive therapy, which is the gold standard treatment for lymphedema. It has 4 components, including manual lymphatic drainage, compression therapy, decongestive exercises, and skincare. Although compression bandaging is an important component, it is not sufficient to manage symptoms on its own, and it should be combined with other components of complete decongestive therapy. Complete decongestive therapy has 2 phases. The first phase is intensive phase. This is when the patients get treated in a clinic setting by a certified lymphedema therapist. So in this phase, you will most likely be wrapped every day in the clinic by your therapist. And once you meet your goals and you are discharged, you can move into the second phase, which is the maintenance phase. In this phase, we typically recommend patients to use both day garments and night garments. However, for some reason, if you don't have access to a night garment or your insurance doesn't cover, and your arm looks more swollen when you wake up in the morning, I would recommend wrapping your arm overnight. Compression is generally safe. However, if you have any infections, including skin infections like cellulitis, if you have sensitive skin breakdowns, including burns or blisters, if you don't have any sensation over the wrapped area, or if you have any blood clots, please wait until you're cleared by your doctor to resume wrapping your arm. I'm also going to include a list of these contraindications in the description box below. So if you missed any of these or if you have any questions, you can check the description box. First, we're gonna re-roll our finger wraps. So we're gonna go ahead and unroll it. We're gonna fold it in half and we're gonna re-roll it. I usually use one hand to fold it and keep it full while I roll with my other hand. So after we have both of these rolled, we're first gonna moisturize our skin and wait until your skin fully absorbs it so that way the bandages don't get greasy. We're gonna anchor this first. I usually like to use my middle and ring finger to keep it down, and we're gonna go around our wrist one full time. Then we're gonna go ahead and bring this up to our little finger. From the base, we're gonna go to the base of the nail bed where the nail starts. You wanna make sure every layer is overlapping about 50%. Now from there, we're gonna go around the finger down to the base of the finger. When we get to the base, make sure the skin right above the knuckles is covered. Usually this is an area where people miss. If your skin is showing, especially when you bend your fingers, you may want to go around one more time, because if the skin is exposed and if there are no bandages, then you may have fluid accumulating in that region. So when we make sure the base is covered, we're gonna go back down to our wrist. We're gonna go around our wrist one more time. And then when we come back to the back of our wrist, we're gonna go up to the ring finger. We're gonna come to the base of the nail. And we're gonna go around, bringing the gauze down. Remember, 50% overlap. We're gonna make sure we cover the base of the ring finger, and then the same thing. We're gonna go down to the wrist, and we're gonna do the same thing with our middle finger. So one thing I want to mention is that you always want to start and finish at the wrist, because if the gauze stops at the fingers, most likely it will unwrap. So for example, here I don't have enough left to go over the entire index finger, so I'm gonna undo this part, and then I'm gonna wrap the remaining around my wrist. And you can go ahead and tuck this in so it can stay down. So we're gonna grab the second gauze. Again, I wanna anchor it using my index finger this time because the other ones are wrapped. We wanna go over the wrist one time. And then we're gonna bring it up to the index finger, going around the base and coming up to the nail bed, where the nail bed starts. And then from there, overlapping 50%, we're gonna bring the gauze down, covering the entire finger. And the reason why we're not bringing the gauze all the way up, covering the fingertips, is because you want to be able to see your fingertips, just in case if the bandages are too tight and if they're cutting off your circulation, you will be able to see your fingertips. So if that's the case, usually you can feel increased pressure in the fingertips, and you'll see that discoloration, and they may be turning blue. So if that's the case, make sure to remove the bandages. Some other indications to remove the bandages are, again, abnormal pain that you haven't felt before, numbness and tingling, and as I mentioned, discoloration. So if your fingertips are turning blue, then you may not be getting blood flow to the area. So if you experience any of these, make sure to remove the bandages immediately. Okay, and then I'm gonna tuck this in again. So now we have our fingers wrapped. Next, we're gonna use our stockinette. If you're wrapping your arm just overnight, you can opt in to not use this as long as you're comfortable and the bandages don't dig into your skin. But if you're using this, what we're gonna do is we're gonna measure from the top of our shoulder to the tip of our fingers, and then we're gonna fold it in half, and that's where we're gonna cut it. So you're cutting twice the length of your arm, because when we put this on, it's gonna stretch, it's gonna become wider, so that's gonna cause some shortening in it. And if it's too long, you can always cut it after. Then we're gonna go ahead and put this on. Make sure to bring it all the way up. It should cover your entire arm. And next we're gonna pinch where our thumb starts. And we're gonna cut a little bit. Just make sure you're not cutting your fingers. I always get a little nervous when I do this. The other thing you can do is you can just mark that area with a Sharpie or a pen. You can take the sleeve off and then cut it and put it back on. So now I have my thumb sticking out. Next, we're gonna wrap our hand. And again, these are not ACE bandages, they are different. ACE bandages should never be used for lymphedema because they can actually cut off circulation. So we're gonna take our 6 centimeter short stretch bandage, which is the smallest one we have in the group. And the same thing, we wanna anchor with this. So I usually anchor it with my thumb like this. And first, we're gonna go around the knuckles 3 times. So this is 1. This is the second layer. We're gonna go 1 more time, and this is the 3rd layer. Once we have the 3 layers here, we're gonna go down to our wrist. We're gonna go around 1 time, not even 1 full time. So we're gonna go from one side to the other, and then we're gonna bring it up again. So we're going around our knuckles 1 time and around the wrist 1 time. We're gonna go around the knuckles and down around the wrist. Around the knuckles. And down around the wrist. Around the knuckles. Around the wrist. And make sure you're covering right where the thumb starts, base of the thumb. The same thing with this, you always want to end at the wrist. And then I usually stabilize it against my chest, or you can put it down so that way it doesn't unravel while you're grabbing your tape. And I suggest actually preparing your tape before you start wrapping, because it's really going to be hard to cut the tape with the bandages on. Next, we're going to move on to our 8 centimeter short stretch. So with this one, we're starting at the wrist. What I do is, with this one, I'll put a tape on one end because we won't be able to really stabilize it or like anchor it using our fingers. It's gonna be a little stiff. So I'm gonna go ahead and just put it down. And I'm gonna go around and cover the beginning of the tape so that way I know it's not gonna unravel. So from here, with 50% overlap, we're gonna bring the bandage towards our elbow. And once we get closer to the elbow, we're gonna do a figure 8. So we're gonna cross the front of the elbow up to the upper arm. Bring the bandage around the upper arm, 1 full circle. And we're gonna cross the front of the elbow again, creating our figure 8. And we're gonna go around making sure the skin is fully covered. And we're gonna continue our spiral style again. And then once we get to the top, you can go ahead and stabilize it against your chest again. And then I'm gonna tape it down. Next, we're gonna use one of the 10 centimeters. So we have 3 of these. One is gonna be spiral. The first 10 is gonna be spiral. The second one is gonna be herringbone. And the third one is gonna be spiral again. So we're gonna start with our first one, which is again gonna be spiral. Again, I'm gonna anchor it with my tape. And I'm gonna go around one time to make sure it's fully covered. And then 50%, with 50% overlapping, I'm gonna bring it down. And we're gonna tape it again. Okay. So as you can see, we're trying to end the bandages all the way up, not in midway, so that way the entire arm is covered. Next, we're gonna do our herringbone, which is an 8-figure style. So I'm gonna grab my second 10 centimeter. And I'm gonna anchor it down at an angle this time. So again, with this one, we're doing kind of a figure 8. So we're gonna go up and down. So first we're gonna bring it around. I'm gonna go down towards my elbow the first time. I'm gonna bring it around. So we're going down. And then up. Next, we're gonna go down again. Moving in opposite directions. And then up. And you're gonna see this pattern where the bandage creates an X. We're gonna continue this all the way to the top of our shoulder. And we're gonna tape it. And the last one is our third 10 centimeter. We're gonna go back to spiral bandaging style. So I'm gonna anchor it first with the tape. We're gonna go around one time just to make sure it's secure, and we're gonna bring it all the way up. Don't forget about the 50% overlap. And I usually place either 2 or 3 tapes for the last one so it doesn't come off, especially when you're tossing and turning at night. And this is how we bandage the upper extremity. So just a few things to keep in mind. We're trying to direct the fluid up towards your trunk, out of your arm. So it's important to bandage your fingers and hand as well. Remember, the bandages should be comfortable. You shouldn't have pain, you shouldn't have any numbness, tingling, or discoloration of your fingertips while you have the bandages on. And do not forget about some of the contraindications we mentioned earlier on, which you can find in the description box below. And lastly, depending on what lymphedema stage you're in, how severe your symptoms are, and the exact procedures or treatments you have received, your treatment or bandaging may look a little different than this. So always make sure to check in with your lymphedema therapist. Other than that, that's it for this video. As always, thank you so much again for watching. I hope you found it helpful. Feel free to share it with someone who may be experiencing lymphedema, especially if they had breast cancer treatment. If you want to see more videos like this, don't forget to subscribe below. And if you want to learn more about lymphedema and cancer rehab, make sure to follow me on Instagram. Thank you again, and hope to see you in a different video.